another video that I think I'm going to publish as a series of I'm not going to share these videos for a while because I think I just want to leave them in private mode, but I feel like I need to just air shit out because I just need to. So this is the week Tim was diagnosed with another, we were informed that his light chain numbers were going up. So they're in the 500s. He's going to be tested next week to see how fast they're growing. And that will inform whatever the next steps are. My hunch is that it's growing pretty quickly because that's what happens with his cancer. And I am just, like, if I could sit and write right now, I would be writing this shit out of paper because there's so much that's coming up inside of me, but I don't have the time to write right now, so I'm going to talk. And I'm just like really tracking my feelings as like partner to my husband, as a parent to my girls who are navigating this, as a healthcare worker. I feel like trapped inside of a broken healthcare system. I feel mindful every single day of how broken the system is because I work inside of it as well, and I feel like I'm working alongside of people who are, you know, have the best of intentions, want to do the right thing, and the system itself is so bogged down with all of the hundreds of thousands of details that need to be tracked because that's how the system is working. And it isn't really working, but there are things in it that are working because my husband's receiving treatment right now that's costing a whole lot of money, and our insurance is covering a large chunk of it, thank goodness. And it's working intermittently, you know, like it's extended his life. You know, he was on death's door a year and a half ago. He's been on death's door a few times since then, but he's alive, and for the most part he's thriving right now. But and I feel weird, like selfish saying this. I feel selfish even having my own feelings and emotions around all of this because my husband's the one who has the cancer. I should be ever so grateful that it's not me who has cancer, and I am. But I feel like I'm really aware of this feeling of like loss of freedom. And I feel trapped in this system and beholden to it. And I have a coaching certification in wellness coaching, and my really deep desire is to help people like attend to their health and wellness before they hit the heavy need inside of the medical system so that they can stay clear of it. And I'm just like, my head's spinning right now because I'm trying to figure out like what happened because I'm in this system and I'm attached in like to this system in so many ways. It puts food on our table, pays for our bills, it provides the coverage of care for my husband. It's the system that's keeping my husband alive. And I feel very far from like being able to help other people stay out of the system. And every single day I'm working with like in some way touching people's lives who are completely dependent upon this system, and many are stuck inside of it feeling the brokenness and yet stuck. If you're working on policy change to like fix our broken healthcare system, thank God for you. If you're working in prevention and wellness and helping people try to do better for themselves before their body fully breaks down, like thank goodness for you as well. If you yourself are trying to do things to take care of yourself feel very strongly that there is a need for me to be exactly where I am. There is a need for me to be experiencing every single emotion that I'm experiencing right now. There's a need for me to be immersed in the brokenness to understand it for some reason. And I don't know what that reason is, but I feel like there is no coincidence that I'm here, exactly where I am, seeing the things that I'm seeing, navigating it in the ways that I'm navigating it. I just can't put my finger on it, and I can't fully understand what that reason is. And so I'm just trying to breathe into that and accept it and like keep my eyes open. I feel deeply grateful that I work with people that I know have their minds and hearts in the right place and are really doing wonderful things for the patients that they serve, that we serve together. I feel grateful for that. I've worked for systems before where I couldn't sleep so well at night because I knew the system was broken, and I knew not only that, but that the people that I was working alongside of were kind of broken too. Like they had been really jaded by the system and were not always making the best choices. I feel like the people I work alongside of help me to make better choices, help me to make the right choices. So that is something I'm super grateful for. Yeah, but I just like, I don't know. I'm feeling a whole lot about it right now. Clearly, that's the case. I know over the course of my past 30 years working in healthcare as an occupational therapist, I've kind of like tried to work myself out of it into the area of prevention, into the area of, even in doing climate work, I kind of wanted to be working to, I just feel like there's so many things that are impacting health, but I feel like the area where I show up each day is like just inside of the system, checking all the boxes that have to be checked so that our government and insurance companies will reimburse. And if we don't check all those boxes, then there's someone who works for some entity that is peripheral to us, that we are dependent upon, that our patients are dependent upon, that's very quick to say, sorry, we're not paying. Nope, we're not going to do it because you didn't check that box, or you didn't put these things in the right order. And yeah. So, I don't know what more to say than what I just said. I think I just needed to air it out and get it off my chest. I'm just swimming in it for the moment. So I think I'm going to leave it at that, and I'll probably do a follow-up post at some point. Hopefully I gain more clarity and insight. Yeah. Kind of holding the fullness of all of it. It's the good, the bad, and the ugly. All right, well, thanks for receiving me if I actually do post this.